Welcome, everybody, to the Doctor's Clinic. This is Daniel Whited from Denver, Colorado. It is just absolutely fantastic having you with us this evening, and those that are listening to the playback call, we're just glad to have you on as well. We're going to kick things into gear, and this is a call that's put together. We take on all kinds of topics, and we run into several things that people have challenges with. So if you need to let Dr. Kurt Fisnick or myself know a challenge you're going through, and maybe we address it going forward into the call. Like, we've got a lot of people, a lot of phone calls lately, people going through autoimmune challenges. And we can help with that all the way from what we do with Sisel to even tweaking diet and making some differences there. We don't make any claims or anything like that, but this is a place to where you're gonna put yourself in a position to have the best health you possibly can through some of the most dynamic products on the planet. And we are going to pop right in right now and get Dr. Kurt Fisnick on here and let him yak at us. Dr. Kurt Fisnick, we appreciate you, man. We're glad that you're here and part of the call, and we're excited what you have for us this evening. Where the world is your waiting room. Dr. Kurt Fisnick, welcome to the call.
Well, hello, everyone. Again, this is Dr. Kurt Fisnick, and welcome to the Sisel Doctor's Clinic call, which is a weekly call where we try to present information to improve your health. We can't say claims of treat or cure or anything like that, and most of us are not doctors, so you can't diagnose. And so I state that right away in the beginning because I really want people to understand that, if you do have something wrong with you, consult with a medical physician. Tonight, I'd really like to talk about something that most people never talk about, and that's kidney health and how dependent we are on having a good function of the kidneys and urination. So the kidney is a small bean-shaped organ. It's located on either side of your spine. It functions to help regulate your blood pressure. It stimulates red blood cell production, and the kidneys help to maintain fluid levels in your blood. And when they're not functioning correctly, they can cause a lot of severe edema, which will mess up your blood pressure. Every ounce of your blood actually runs through the kidneys every 20 minutes for filtering. Think about that. Every ounce of your blood runs through the kidneys every 30 minutes. That's 200 quarts of water per day and 2 quarts of toxic waste that's dumped out through your kidneys. That's a lot. Another function of your kidney is to produce a hormone that's called erythropoietin, a hormone that stimulates the production of red blood cells in the bone marrow. So you can see that if your kidneys aren't working right, they can cause a problem. But most people don't give the kidney health a whole lot of thought until the vital organs stop working. And if they shut down completely, you don't have a lot of time. Toxins inside your body can rise to lethal doses in just a matter of hours. According to the Centers for Disease Control, kidney failure is the 9th leading cause of death officially in America. Your body can survive with one kidney, but if you have total shutdown, there's only one treatment, and that's dialysis. Once you start dialysis, you're really in it for the rest of your life. And that's where medical equipment basically takes over for the function of the failed kidneys. And they recommend kidney dialysis when the function of the organs is down to about 10 to 15%. But when that's not an option, or when there's other options available, kidney transplants can help. But, man, I'll tell you what, after looking at this information this morning, the demand list, the people that need a kidney, outweighs the donor list by hundreds of thousands of people every year. There's 26 million people just in the United States that have some form of kidney disease. Most are unaware. 50,000 people die per year from kidney disease, but you just don't hear about it in the mainstream media. If you understood this, you'd understand why there's more people that die from kidney disease than from breast or prostate cancer. It costs the insurance companies and the public billions of dollars each year. So it goes without saying, if you have healthy kidneys, start taking care of them. So I'm going to tell you a few things that you might want to be aware of that indicate that you may have some kidney issues. Once you start having high urine output, if you find that you have to pee more often, what if your urine is dark colored or pink? It indicates there's a problem. Fluid retention, edema in your arms and your body and seizures, elevated thirst levels, pressure in your chest, difficulty breathing because of that, unusual problems with sleeplessness or sleepiness and weakness, nausea, problems with cognition. These can all be indications that you have a kidney problem. But excuse me, I wanted to discuss a few things about kidney issues. We all know somebody who's had a kidney stone. It happens to about 10% of the population. Most kidney stones often contain calcium that's combined with a phosphate or an oxalate. And a lot of really uninformed or uneducated physicians have recommended to people that when they have kidney stones, they should discontinue taking calcium. My mom was told that just earlier this year by a well-known doctor in our area. In reality, this makes the problem worse because it's not due to excess intake of calcium, and it's really related to the opposite. It's caused by extra calcium not being excreted properly. So let's take a look. A Harvard nurses study actually indicated that nurses who consume diets higher in calcium were at lower risk for kidney stones than those who did not. Well, why is that? Well, the stones are made of calcium and a substance called oxalic acid. The oxalic acid comes from the diet. It passes through the intestinal wall into the blood, and then that's where the kidneys grab a hold of it, and it's combined with calcium in the kidneys. Calcium oxalate is the cause of the stone. Okay? However, when the calcium in your digestive tract is attached to the oxalic acid while it's in the digestive tract, it won't pass through the intestinal wall, and it gets eliminated with other waste products. So not only do you have a higher risk of bone health issues, but kidney health issues if you don't get adequate calcium. Another doctor in my area here, he used to recommend the use of Tums and other antacid as a calcium because it was covered by medical welfare, Medicaid type of insurance, and that's not the right form of calcium, so you do need to get the right form of calcium. Another thing that I hear people talking about is that, they have to eliminate coffee or tea. Well, absolutely not. If you drink a coffee or tea that's formulated to be healthy, like the coffee we have with Sisel, it's actually good for you. And as a physician, I do say, keep an eye on the amount of consumed caffeine and drink natural citric beverages to kind of balance things out. Keep that vitamin C level up there. Most people don't drink enough water. Let's look at the amount of water that somebody perspires and excretes by taking a typical NFL lineman. In a 4-hour football game, they'll excrete and perspire up to 10 pounds of water in that time frame. So that game you lost, you won. The game that you watched last night on Monday Night Football, 10 pounds of water. So that gives you an idea how much water somebody gives off. So we really need to make sure that we're drinking enough. The two biggest risk factors for kidney disease are the side effects associated with diabetes and heart disease. Diabetes is actually the leading cause of kidney failure, coming in with a close second of high blood pressure. And so you can see why taking a look at your lifestyle, eliminate factors that cause these problems, will actually lower your risk of kidney disorders. Add on top of that obesity, which is a major problem not just in the United States but around the world, inadequate nutrition based on the typical standard American diet, compromised immunity, the people that still smoke, substance abuse, chronic dehydration. And you start seeing the picture here that your lifestyle adds a lot to it. But one of the things that a lot of people, I guess they really don't think about is that long-term use of Tylenol and other over-the-counter drugs will cause problems with the kidney. When you combine two or more of these analgesics along with caffeine, it's really going to cause kidney dysfunction. Acetaminophen seems to be the one that's the most toxic to the kidneys, but everybody really needs to look at their situation individually and again, consult with your doctor. But long-term use of these drugs is not considered safe. It's not considered healthy. And many people feel like they can go to the supermarket or the convenience store with no restrictions. So how can it be bad? Man, I remember when I first got into practice, I had a patient that was taking over 100 capsules a day. And his doctor actually approved of this because he just didn't know. The doctor didn't know. So how does heart health relate to the kidney? Well, in 1932, homocysteine was discovered. It's normal in small amounts in the blood of healthy people, but when it rises, it can cause some problems. Normally, it's metabolized in the liver by vitamin B6 and vitamin B12. Lower than normal levels of these or folic acid can cause a rise in the homocysteine levels. And when you combine that with the idea that glyphosate actually causes problems with these B vitamins, you start to see a problem here, a situation that can happen even when you have adequate levels in your diet. But homocysteine is associated with atherosclerosis, strokes, heart attacks, dementia, Alzheimer's disease, as well as kidney disease. It'll increase the risk of heart disease threefold over a 5-year period of time, and usually there's no clinical signs of hyperhomocysteemia. So we have to get that checked by their doctor every year and make sure that they run this test. It should normally run under 7. Your intake of folic acid, B12, B6, choline, inositol, and zinc will help keep this under control. One problem that's fairly silent in damaging the heart, the brain, the kidneys is actually heavy metal toxicity. A lot of people really don't understand how serious this situation is, but we live in a real toxic world. The lead and the mercury that's found in our environment has gone up hundreds of times over the course of the last couple hundreds of years, and it's listed as one of the top causes of cancer in America, with cancer being one of the risk factors leading to kidney disease. Toxicity increases inflammation. That can be a cause. Multiple degenerative disorders, autoimmune problems are also a common link. A blood test that determines this is the C-reactive protein test. I have that tested every year. Using nutritional products, we can help lower that. We can lower inflammation with an excellent protocol that we've put together. We can't, again, say cure. We can't say treat. But, boy, I sure can tell you that there's some things that we can use to help the body. John Hopkins found that patients who are obese had double the rate of developing kidney disease. Combined with that, they found that if you're a smoker, you have a 60% increased risk of losing the function of your kidneys if they start to fail. So what steps can you take? Well, control your blood sugar. 90% of diabetes is type 2, and that's 100% preventable and mostly reversible. Know how to control your blood pressure. Have it checked regularly, because in many cases there are no symptoms. It goes without saying, exercise is important. Get involved with a regular program. Find something that you like to do so it makes you go and get it done. Stay active at least 20 minutes per day. Drink adequate water. A half ounce per day per pound of body weight is kind of the formula that I use. Avoid food that's been sprayed with pesticides. Use a fruit and vegetable rinse that takes its residue off. Quit smoking. If you smoke, for God's sakes, you got to quit. And avoid unnecessary medication use, even the over-the-counters, the OTC type of drugs. So it goes without saying that you need to become a citizen scientist. Learn how to read labels and how to make better food choices. Lower your intake of phosphorus and sodium and other processed ingredients. Eat lean meat and fish. I always say, when possible, use wild game or farm-raised, naturally lean, grass-fed, and green-finished beef. A recent article I just read said that when we started increasing the consumption of chicken and other poultry, we started finding some other bad side effects. It turns out that these meats contain higher levels of toxins, and that this is leading to some pretty major health concerns like the rise of pancreatic cancer. So you can't substitute common sense with ignorance. Simple carbs, they're just not healthy in any way that you can come up with. Kidney failure is painful, it's expensive. Chemo treatments for cancer is one of the only other health conditions that takes more doctor or clinic visits. So at this point, I'm going to hand it over to my buddy Daniel Whitehead, DW, and talk about the products that we have with Sisel that can kind of fill these needs. There's a lot of things out there. So I'm going to hand it over to DW. DW, if you want to talk about the nutritional supplements that we have over here and how we can help improve somebody's health. Thank you. Thanks for listening. And I look forward to speaking to you again next Tuesday.
Man, that's awesome, Doc. We really appreciate it big time, and everything that you bring to the table. Some of the things, and you can kind of correlate when you're talking about diabetes and sugar sensitivities and high sugar levels, and and how it relates to your kidneys. You're talking about your high blood pressure, which is very damaging for the kidneys to start with. And then the consumption of beverages that cause all kinds of havoc. The massive amounts of inappropriate or non-natural caffeine, the soda pops that are jammed with chemicals because people are doing a lot of diet soda pop. It's very, very damaging. And then you jump into, even some of how the alcohol can cause some of the challenges. And so one of the first things we want to do when we're working with somebody and we want them to operate operate with optimal and optimal health is we do want there to be a little bit of a cleanse of the liver and a cleanse of the kidney. This is why if someone's really sick and going through challenges, we'll start them off with the Ficoidin. And we'll do small doses multiple times during the day. If you're someone who already has sugar sensitivities and or even type 2 diabetes or whatever's going on with you there, you want to spread the Triangle of Life, which consists of the Ficoidin, and it consists of the Spectramax and another product that has resveratrol in it, which is Eternity. So we start someone off with the Eternity. After, that's the second thing we go to after we've got them doing the Ficoidin for about 3 or 4 or 5 days. Then we start with the Eternity. And, matter of fact, a lot of these challenges, sometimes people are a little bit confused, and when it comes to even urinary tract infections or prostate infections or swelling and any of those kind of glands that would cause you irritation or frequent urination or getting up too many times during the night. Your body will tell you when your kidneys have been taxed too much based on what you're doing. And one thing you want to do is hydrate the body, and Doc talked about that. So, we start with the Ficoidin, and then a few days later we kick in the Eternity and the resveratrol. The reports the studies that are coming out on that are just crazy good. But we also want to take our diatomic hydrogen water system and hydrate the body and keep yourself completely, totally hydrated at all times, and allow that diatomic hydrogen to get flowing through your cells and through your system. It's going to put you in a position where you feel better, and you can operate at a higher level. You can go longer, have more energy. So to get the kidneys now, sometimes if people just going through challenges and we've got a couple callers that have called me recently and talking about one in particular talked about his brother's had to have a kidney replaced, and he was like, man, I think I'm getting ready to go through what my brother went through, and we don't wish that on anyone, but the things you can do is get away from sugars, get away from anything that's a starch, which is your rices, your noodles, your potatoes, and back off on those things. Careful about how much fat intake that you're having as well. Making sure you're putting yourself in a situation to where you've gotten rid of all gluten that you possibly can. These are the things that will help you get your life back. Now, when you're dealing with some of that, we do the Eternity. And then something you may want to talk about is the Energy for him or her. Consider doing that. Body Shield. Then we add Body Shield on as well because it gets heavy metals out of the body. And if heavy metals and fatty stuff, if you got like a fatty liver or going through just where your kidneys compromised with too much stuff to process, the Body Shield's a big plus. One of the things that you're going to find a tremendous blessing to just overall health is a couple simple things. Matter of fact, Marianne taught me this, and I go back to the very first chiropractor that I went to when I was young. His name was Dr. Hertz. Now, there's a name for you. But I played a lot of very intense sports in high school and in college, and I would go to him to just keep things in line and flow. But he would talk about putting a ball, like, say, a golf ball, and roll it on the bottom of your feet and your heels and the inside of your foot and causing that stimulation to take place there as well. But here's something you're going to find tremendously helpful. Take our green tea, and you can do this and put it into a pitcher of about – put about 5 bags into a pitcher. And when you do this, you're heating the water up, you're letting the tea seethe so that it absorbs properly. Then you pour it into a pitcher that's full of ice. In the pitcher, you can have some lemons in there. You can also, if need be, you can put a little raw honey. And if you're going to use raw honey, try to use something that's local. We got a raw honey that we use here that's Colorado honey. That also helps with allergies as well when you're using pollen that's in the honey that's from your region. That is just an added benefit to it. And you can put a lemon in there and you let that set for a while until the ice melts. And then drink that just as a nice, cool, refreshing drink during the day. That's going to help get the kidneys hydrated, the prostate hydrated, all the organs are going to get more hydrated with that. Then, Encompass 360 is something that is really good. And another thing you don't hear us talk about a lot, and we do talk about a lot, but you're probably not hearing us talking about it with any kind of intensity, and that's getting some very mild, consistent exercise. See how far you can walk in 10 minutes and stop, then turn around and walk back. And don't go fast, not jogging or running, just a good, nice walk. You want something that your muscles have to make your body go forward, that there's no momentum making your body go forward. So you want maximum resistance, so you walk at just a good pace and get some of the exercise in. That's going to be a tremendous benefit to you there. And so, those are some of the things that we do when it comes to prostate and kidneys and helping people get through some of those challenges. Inside the heel, when you roll the golf ball, is actually highly recommended. I wanted to make sure I covered that not just the inside of the foot, but all through the heel. And each day you do it for about 5 minutes on each foot. And then you can end up doing it twice a day at 5 minutes and 3 times a day at 5 minutes, and you're gonna find your body responding well. Careful what kind of breads you're going to eat. The recommended bread, one of them that I recommend is the Ezekiel bread, right out of the Bible, but it's called Ezekiel bread. And you'll find it to be very, very, they have it in just the plain and ordinary bread, and it's quite good for you. Don't go nuts and eat too much. Moderation is one of the keys to what we want to do here. And we mentioned earlier the energy for him or her. And if you're really going through kidney challenges, prostate challenges, those kind of things, you may want on the energy, do 3 in the morning and 2 at night. That's something that might be a benefit to you. Eternity, if you're really having serious problems with prostate, kidney, and you're trying to heal it back up, you can do 3 to 4 ounces of that a day for several days, and then back off to recommended doses and small doses as you go forward. So the Ficoidin, if you're really sick going through challenges, you want to do 3 ounces a day. You want to do maintenance, then just do the recommended dosages that are recommended there. The Body Shield, be taking it morning and night. That's going to be a big deal. And on the tea, you can do 5 packs. You can do 3 packs. Miss Helen always puts 5 packs together because we share that drink. And here again, get rid of the pop. Get rid of anything that has carbonation in it. The carbonation can literally strip the calcium right off your bones in little, small slivers at a time, and not slivers that you can barely see them, but they're very small. You don't need that. It's just not necessary. So pop is absolutely one of your greatest enemies to the body. It's rates right up there with smoking and the alcohol. So, and here again, moderation is in there. And doctor was very good about how much water you should drink, and got into that a little bit. So those are the things that we use, and that when I've got someone that's going through some kidney challenges or prostate challenges, I will go through everything I have for you. I have it written on a piece of paper. Someone calls, says, man, I'm going through prostate and kidney challenges. I pull the piece of paper up just like I did for this call, and I just went right down the list of what I have that individuals are going to want to get their hands on that's going to help them. And so, but the key is getting that Ficoidin in your system, and sometimes even first thing in the morning, taking your Ficoidin. And it has that brown seaweed in it, and that's extremely good as a cleanser. Don't be afraid. This sounds kind of goofy, but don't be afraid to drink a good 6 to 8 ounces of water right before you go to bed. You can go to the bathroom first. A lot of people don't because they're afraid, it's going to, it does just the opposite, hydrates your body. It is extremely good for the heart to have water, an extra water in your system. Just think of your body as burned up all the, just like you get real thirsty sometimes when you go exercise. Why? Because you've steamed off all the liquids inside your body. Well, you want to go to bed with your tank empty or with it just a third full? No, just get you 8 ounces of water and drink some good diatomic hydrogen water. Hydrate that body before you go to bed. It's fantastic for your heart. Grab another 8 ounces right when you get up in the morning, and you're going to find yourself just feeling better and better and better. A lot of this is diet. So, backing off the dairy and the cheese and all that kind of stuff is going to be a big benefit to you as well. And, you're going to get healthier. Well, that's it tonight for the Doctor's Clinic, and we're just so glad that you're a part of it. And Dr. Kurt, you did absolutely awesome. We love you, brother, and big blessings to you. And for everyone that's got a chance to hear this call on replay and hear it live, we're very thankful for you. And you just have yourself a tremendous week, and start doing small steps every day to get yourself a little bit healthier, and watch it all compound and build up for you. This is a Doctor Clinic where the world is your waiting room, and we're glad you're part of it. God bless. This is Daniel Whited, over and out.